This is Dr. Alan Reznik, and this is an arthroscopic video of a lateral vernacular release for a tight lateral vernaculum and conjunctival patella. Here we see the undersurface of the kneecap showing conjunctival patella or loose articular fragments below the kneecap itself. This causes crackling and crepitus in the knee as well as knee pain. Here we see those fragments being removed. We take care not to remove the cartilage base, only those loose fragments that are causing symptoms. Here we see the tightness of the lateral vernaculum or the lateral tissues of the knee on the outer edge, and this is what's causing some of the compression against the kneecap. The kneecap is tracking laterally here, and the tightness along the side is adding pressure to the undersurface of the kneecap as well as increasing the lateral tracking. By releasing this tissue, we can improve the tracking. Here we also see that we're using an electrocautery. We're paused right now over a blood vessel, and then we cut the blood vessel with the cautery itself. By cutting the blood vessels with the cautery instead of using a regular scissor or knife, we are allowing ourselves to stop the bleeding before it occurs. One of the major complications of lateral vernacular release done in other methods is a hemarthrosis or bleeding into the knee. This can cause an increased rate of infection and other complications. By using this underwater electrocautery, we can cauterize those vessels under direct visualization and reduce the risk of hemarthrosis significantly. This leads to better patient outcomes from the procedure itself and less complications. Here we see we're sort of coming to the end of the lateral release and releasing the final bit of tissue down at the bottom, and you can see how much space has been developed between the edge of the femur below and the patella above, which is now out of the field. Now we can see that gap quite well. If we let the fluid out of the knee, you'll see how this gap will then close down. And then if we let the fluid back in or push on the patella, we can see how the gap opens up, indicating that we've in fact released the tissues on the inside and allowed more mobility of the patella itself. So here we see the fluid coming out and the gap closing. And here we're either pushing on the outside of the knee or letting fluid back in. You can see the gap opening, showing we've completed the release. This completes the video on lateral vernacular release. Thank you very much. I hope that this has been very helpful. If you'd like more information, please see us on our website at www.togct.com for other information, surgical instructions, and information about multiple diagnoses in orthopedics.